Thank you. Thank you for inviting me. I'll give a presentation of the Norwegian model, and which is quite unique. The background for it, how we did it, and some of the problems that we have met and how we're trying to solve it. But first, let me give you a brief presentation of Norway. It's a small country, northwest in Europe. Population about 5 million. Widespread country. People living all over the country, on every island, everywhere. We have the lowest unemployment rate in Europe, I think, under 3%. And the participation rate is also quite high. It's mostly due to that women participate in the labor market, and that older people, they work until they're 62, 63, 64 or more, generally. We have had a low unemployment for many years, but we also faced rising unemployment in 1994-95. I remember I used to work in the ministry, and the unemployment in Europe, it was about 8, 10, 12%, and we reached 4-5% in Norway. And everyone knew that it was impossible to get the unemployment down back to 3-4%. So, and this was told by all the professors from the OECD, from every expert. We should make a speech for the minister. And this is the youngest, the person. He started to write a speech, and then it continues through 4 or 5 different persons, and then the speech comes to the minister. And my new colleague, young person, he wrote that in a few years, I think the unemployment in Norway will be back to under 3%. And I knew that was insane, so I took it away. And we prepared the speech, and the day after we could read in the newspapers that the minister was quite optimistic. He thought that the unemployment would be under 3% in a few years, and everyone said he must be insane. It was, of course, a previous version of the speech that he got, but it took only 2 or 3 years, and then the unemployment was back on a very low level. So that this shows that the labor market in Norway is in many ways very flexible. We also have 2 different traditions that I'm going to discuss now. We have local authorities in Norway, municipalities, a lot of them. We have 428 municipalities, and many of them have no more than 5,000 or less inhabitants. So they're very small to handle the different tasks that they are given. And at the same time, we have a tradition for national control over the economy, and this how to handle this the things is what I'm going to discuss now. Although the unemployment rate is very low in Norway, we have a lot of people on health benefits who are outside the labor market. And they stay there for a long time, and a lot of them doesn't come back to the labor market at all. So in Norway, almost 1 of 5 person in the labor market age are outside the labor market due to health problems. And that's, of course, could be called a hidden unemployment in Norway. It's something very strange that in times where the health should be better than ever, that so many people are outside the labor market. And that's what one of the main problems that we wanted to meet when we started discussing a reform. We also faced a lot of people outside the labor market on social benefits. And we had huge problems to make them come back to the labor market. They were under responsibility of the local authorities. And we had problems to handle the cooperation between the municipalities and the state level. So this was one of the main drivers behind the reform that we started to discuss. And for many years, we had all kind of commission discussing various models. And they couldn't really agree. But we saw that we had different institutions, and we had people was sent from the one institution to the other institution to a third institution and so on. The authorities together wasn't able to give the help that the people need. And that especially the receivers of social benefits, they kept staying on social benefits for many years and didn't come back to the labor market. We also saw that if you had health problems and was receiving benefits and was outside the labor market, it wasn't not activity to make you come back to the labor market. So it took many years, often 5-10 years, to come when you started labor market programs. And then you had been outside of the labor market for so many years that it was almost impossible to come back. So it was a need for a stronger collaboration between the social services in the municipalities and the state organization. So then we started to discuss, should we have a local or organization influenced by the government, or a more regional organization where they're influenced by the municipalities. And after a long, endless discussion, we ended up with something in between, and I come to that. When we discuss what kind of organization we should land on, we had different arguments. This had been discussed also earlier today. I just pick up a few. It was, of course, in Norway, as in other countries, was afraid that unemployed people was not going to be placed over the boundaries and kept in the municipalities. So we wouldn't have the flexibility that we need. We have also very small communities, so we was afraid that the focus and priority of the labor market policy would be too low in a lot of municipalities, at least. We also was afraid that we wouldn't have the flexibility if the labor market should change. This reform was implemented in a time with very low unemployment, but if it should meet really high unemployment, would the municipalities be able to cope with it? That was the question. And also that some of the services that you receive in the local offices gives you right to certain benefits. And it was a point that you should treat people equally. And that was perhaps better taken care of if you have a national model. In Norway, the state is responsible for almost every benefit, so you don't need some extra benefits from private sector. You don't have to have to insure yourself. Some do, but mostly benefits are taken care of by the states, also unemployment benefit and sick leave benefits and so on. The link between receiving benefits and that we can follow you and give you some orders that you have to search for jobs, to keep these two measures together was also very important in Norway. But also having all in one state-driven, huge government organization has some disadvantages that we have to take in mind. And one of the things that was care about was that if you have these very large organizations, that you probably end up with administration and was not so concerned about the outcome. We also was afraid that pressure from the users of the organization would make the organization concentrate on benefits and not on bringing people back to work. Such a large organization will have problems with changing focus if the environment changes. This is probably easier if you have small local authorities. And we really discussed, and we did put together a lot of different tasks in one huge organization, and we was afraid that it was a bit difficult to reconcile both the breadth of the topics and the expertise in one organization and in the stately driven offices. And this was also something that we learned, that this was a bit difficult. If we had in Norway much bigger communities or municipalities, this would be perhaps been different. In Denmark, they had municipality reform some years ago, and they decided that to serve this kind of services, a municipality needed at least 100,000 inhabitants, and in Norway, half of the municipalities have less than 5,000. So it's impossible to give this responsibility to the municipalities if we don't have a reform, and that's also a discussion in Norway these days. So we ended up in merge between the social insurance, public employment service, and the social services on the municipality level. They meet in one office. And the organization that we can see is that we have one service sector that with 456 local offices in 428 municipalities. That means that some of the biggest cities have more than one office. What we have done, and that's probably the special thing, one of the special things with the Norwegian model, that we have in a lot of countries that we have visited, we can see that we place local services and state services together in one office, but they are governed by the state or by the local authorities. But in Norway, this is set by law that this is a common office. It's driven together, and they're responsible together. They're also responsible for the funding together between the local authorities, and the central authorities. The manager, mostly one manager, sometimes two managers, one from the state, one from the municipality, had to report both to the municipality and to the state. This is, the idea was to take out the best from centralized models and decentralized models. And the idea again was to combine the need of flexibility that can be handled on the local level with national standards and how to do things, how to we have some standards how to decide the level of assistance that one should receive, how to decide if a person is entitled to a specific benefit or so on. Is handled from the state and from rules set by the state. This has led to a strong integration between the local services and the state services, national services. A few years ago, before the reform, if a person with some needed assistance from different kind of organizations, it could take up to a month to set up a meeting and make all the helpers to meet and decide what to do. And now the same person is responsible for all kinds of services and can fix it in 10 minutes. So with these groups, this is a much more efficient way of handling things. This is, we also have that the state has taken a greater responsibility for the more vulnerable groups that previously was taken care of only by the municipalities. So a lot of people that formerly received social benefits are now entitled to state benefits and taken out of the municipalities' financing. But at the same time, we have some weaknesses in this kind of model. It's a bit unclear who's responsible, if it's the state or the municipality. And if you have bad results, if you have problem with the financing, the operations, and so on, who's responsible? And what should the state do if the municipalities reduce their investments, and so on? And it's also quite difficult to move resources from one municipality to another municipality. And the managers, they report two ways. They have to plan it in two dimensions. They have to attend to two meetings, one in the municipality and one at the state level. I think they spent too much time on this dual reporting. So it is a discussion in Norway. This model can sustain over time. That we're not sure of, but it also have some very strong sides that we have we're satisfied with. If we go to the current situation, we can see that no, sorry. When we started, this was a huge reform in Norway. Every structure that we had vanished, and they had to be rebuilt. The managers that was set to lead the offices, they didn't have the experience. At least in many of the tasks they should take care of. So we had some really big problems during the first years. But after a while, it's calmed down, and now we think that we can begin to see the results. In some ways, we are performing better than before the reform, and in some other ways, we almost the same as before the reform. And we think there's a potential to improve a lot in the coming years if we get the opportunity to do that. The users, they are still, and was before, I have to say, unsatisfied with the information they receive, so they have to call us and write to us a lot. We see that what we tried to do was to build a one-stop shop in the municipalities. And to a large extent, we have managed to do that. So these kind of services are well integrated. But at the same time, if you're receiving benefits, you have to receive them from another part of the organization driven by the state. So we have created some new problems with handling the internal services across the organization. And that's a problem for us that we have to work on now. But the satisfaction from the customers, they are now a bit better than it was before the reform. The organization taken care of, also we pay about 1/3 of the state budget. So it's a lot of money going out from NAV. And it's difficult to steer and to take care of the all of the issues that we are responsible of. My boss, when he should meet his Swedish colleagues, for example, or in the neighbor country, he meets perhaps 10 persons. So all these services is one organization in Norway. Yes, and but as I said, the services for the people that need help from different kinds of the organization has become much better, and we can see that we now take special programs for people on social benefits. They have been out from labor market perhaps for 10 years. They've been giving up, the help has been giving up them, and we get almost 40% back to work. So that's very good result, I think. Yeah, but at the same time, unemployed, more regular unemployed, not on special needs, I think that the services from those groups has not been improved. On the contrary, is not as good as it was before. And we see that we have to work on labor market competence and contact with employers a lot. This was something that vanished during the reform period. Because there was so much new things to take care of. So, yeah. Finally, we believe, at least now, that this organization is the right for us. If Norway had been a country with very high unemployment, I wouldn't recommend this kind of organization. This is an organization that are designed to meet the very high proportion of people outside the labor market due to health problems, and to help people with social problems to get back into the labor market. That's the special feature for this kind of organization, I think. But nowadays, our government is discussing reforms municipalities reform. Every politician in Norway almost want to reduce the number of municipalities from 428 to 200 perhaps, I guess, and to make the municipalities willing to do that, they have to give them some more tasks to be responsible of, and it be interesting to see for us if some of the tasks that's the NAV, the state organization, is responsible of, is going to end up at the municipalities when the reform is finished. Yes, I think I'm in my presentation there.